Welcome to Vitamin OC. I'm Joanna Weiss.
And I'm Whitney Gomez. Every week we bring you your recommended dose of civics and civilization in Orange County.
And today we are so excited to have our friend, Dr. Allyson Brooks here. Dr. Brooks is a certified OBGYN and has been practicing in private practice here in Orange County for more than 20 years. She is one of the most renowned experts in women's health, and we're so grateful that she's here sharing her time with us and expertise with us today. She has been in various leadership and executive positions at Hoag Hospital over the last 12 years. She's currently the Ginny Ueberroth Executive Medical Director, Endowed Chair for Hoag's Women's Health Institute. We got to meet each other and know each other when I was running for Congress,
Yes.
and we have a shared passion for women's issues and women's health. I so appreciated getting to spend time with you and meet you then, and we're so grateful that you're here on Vitamin OC.
I'm thrilled to be here.
Dr. Brooks, I have seen you speak a number of times about Hoag and the Women's Health Institute. And we're really excited to talk to you about the explosion of resources in Orange County for women, which you have been at the forefront of. So thank you for that.
Yes.
And I just want to make our listeners aware that you served on the Board of Trustees at Hoag for 6 years, and you were also the Chief Officer for Quality, Safety, Regulatory, and Performance Improvement. Over the pandemic, you had that position, so that must have been wild.
Yes, it was.
And I read that you have 3 sons.
I do.
Which is really incredible given the resource that you are for women and girls.
Right. That's probably why I'm a resource for women and girls.
Potentially. Can we start by talking about what's going on in Irvine at Sand Canyon? And I know that the number of births at Hoag is up considerably. Can you talk to us a little bit about those developments?
At the Sun Family Campus in Irvine, just off of Sand Canyon, we will be opening a new women's hospital and a new cancer and digestive health hospital, as well as a surgical pavilion. So the surgical pavilion's opening, I think, in early spring 2026. And 1 year from now, we'll have the new women's hospital. And it's very exciting because we have seen a tremendous recovery of the declining birth rate. In fact, here in Orange County, we are delivering over 9,000 babies a year. So it's been a little surge.
And can you talk to us about what it means to have a Women's Health Institute? Is everything under one roof? Is it a concept? What does that mean?
To be an institute is a combination of health centers, facilities, as well as the physician and allied health professional workforce, and then also many programs. So I think we have 18 different programs within Women's Health Institute. So it's a virtual model, I would say.
And what are a couple of examples of the programs?
We have maternal fetal medicine. We have oncoplastic breast surgery. We have family planning. And also in pelvic health, we have a very expansive pelvic floor physical therapy program and a robotic surgery program and a minimally invasive gynecology program and a maternal mental health program. So those are just a smattering of the types of things. But each one of those programs is led by a physician or physicians. The programs are, and the content or curriculum are grounded in evidence. So they're evidence-based, and where there isn't evidence, it's evidence considered. And many of them also offer clinical research, and they're multidisciplinary. So there's an entire team that surrounds a patient. It's not just a physician, for example. So you would have, like in pelvic floor physical therapy, we have nutritionists and fitness trainers, as well as physical therapists and a sex psychologist and a urologist or urogynecologist and an OBGYN. So we try to have all the wraparound services and all the expertise around a single patient.
I think when I saw you speak at the first H.E.R summit, you brought up pelvic floor.
Right.
And I was quite a bit younger. My jaw was on the ground. Do you want to
Right.
talk a little bit about why you made that a priority?
And can you explain what the H.E.R Summit is?
Let me just explain what the H.E.R Summit is first, and then I'll share a little bit more about pelvic floor physical therapy. But the H.E.R Summit is a women's summit that this year will be, it's a half day. So I think from 9:30 in the morning till about 3 in the afternoon. And there will be 13 to 15 clinical specialists that are being interviewed either individually or as part of a panel providing information on the variety of things that women experience in their lifetime. And the keynote speaker this year is Dr. Mary Claire Haver, who you may be familiar with, is what I call a physician influencer. She's an OBGYN who has galvanized if not the United States, the world around what it's actually a movement. So perimenopause and menopause, what women can expect, what they deserve, and really challenging the workforce of physicians and additional professionals to know what they're talking about and help women in what they need. You mentioned about pelvic floor physical therapy, and that's been about a decade of undertaking, in the sense that a decade ago, when I spoke about the pelvic floor at a conference, I was sort of chastised afterwards. We're at a luncheon. We don't really need to talk about below the waist in women. And I said, well, we kind of do, because everyone has a pelvic floor, even men do, but women really have a pelvic floor. And that pelvic floor is responsible for a lot of things, like our continence, our sexual function, being able to stand upright with comfort. So many disorders are related to our pelvis, and oftentimes are related to having children, childbearing, and aging. So knowing your pelvic floor and knowing that it can be treated without surgery and can be addressed with physical therapy, as well as with fitness and lifestyle experts and nutrition experts and acupuncture and integrative therapies, is something that many women didn't know about 10 years ago. And now, when I was in a room recently of 700 women and I asked them how many knew that they had a pelvic floor, after they laughed, they all raised their hand. And I thought that was a success. I mean,
Absolutely.
in 10 years to go from being chastised to being embraced. I thought that was awesome.
I was amazed when you spoke also that you said that even if you haven't had children, as you age, the pelvic floor can become an issue.
Yes. My patients used to ask me for an explanation of what was the pelvic floor. And I said, it's a big muscle. It's a hammock muscle. And it can sag and it can drag and it can separate. And so no one wants a sag, a drag, or a separation. And if you have it, we would like to strengthen it and help you understand how it works and what you can do to maintain it.
That's amazing. And one of the things that got us talking, I think probably because we're about the same age, was menopause resources. And you mentioned Dr. Mary Claire Haver, who is world renowned now. And we are so grateful that she's coming to Orange County to talk to women. And I hope that many of our listeners will attend. There are not tickets available in person, but they can get tickets online.
Yes, they're offering live stream, and it's at a markedly reduced rate. Last note that I heard was that about 450 women will be in person, and thus far about 100 will be live streaming.
Wonderful.
I'm having a live stream party. I'm still hoping to go in person, but I've got a couple of friends coming.
Oh, that's great.
That's great. One of the things we spoke about maybe a year or two ago was resources that you were bringing to and working with Hoag to make sure that they're addressing the menopause issues. Can you talk a little bit about what resources are available?
When I mentioned before that menopause is a movement, it really is. And, all women, if you live long enough, will eventually experience it. And some women actually experience cessation of their ovarian function prematurely at less than 40. But women's health is menopausal health, or menopausal health is women's health. And what we're seeing is that our children, like my sons and their wives, these 30-year-olds, want to know what's going to happen to me, what's going to lie ahead. And I don't want my midlife experience to be like my mother's or like my grandmother's. I want it to be talked about. I want there to be clinical resources. I want a knowledgeable physician or clinician. And I want access to hormone therapy without people saying that the risks outweigh the benefits. And I think we've come to a point where we know that it can be safely considered in all women, and for those that it is not something that is safe or encouraged, that there are alternatives. So that's really where we are, is trying to mainstream menopause and midlife and perimenopause in the same way that we continue to try to mainstream mental health and mental wellness.
And would you say the practitioner for someone in menopause is usually the OBGYN, or are there other doctors that you would suggest people see?
Well, we're really trying to expand those that specialization or special knowledge about it beyond the OBGYN, because obviously the primary care, family medicine, internal medicine, all of those individuals will have women with a variety of complaints. So we don't want to see each of the symptoms addressed in a silo. We want them kind of packaged up and say, oh, based on what you've told me, your hot flashes, your irregular periods, some of your sleep disturbance, some of your, maybe, I'm not going to say they're irritable, but they might claim to feel irritable or frustrated
Never.
or, you know.
What? One of my clear indicators.
Right. Yeah. I mean, just a lower tolerance for some behaviors that we might see in our household or amongst our children, right? Our husbands, partners, etc. We want those to be looked at all in one bundle and say all of this could be explained by the volatility of your hormones and the fluctuations that happen during this time. And these are the things that can be done to manage those. And these are what we know to be true.
So you mentioned menopause-related services and hormone replacement therapy. Could you talk a little bit deeper about hormone replacement therapy and what some of the updated studies say and what options are available to women who might need some relief from hormone replacement?
Sure. Thank you. Those are great questions. I did want to add one other thought when we were mentioning about a variety of resources that are available, that one of the things that I'm seeing is more and more husbands coming to me and asking, can my wife come to the H.E.R Summit? Or do you have special resources for women going through hormonal transitions? So why I bring that up is because the awareness is expanding beyond women, and it's expanding beyond the women that are experiencing or going through those transitions that may be actually suffering. And so their children are interested, their spouses are interested, and we're also seeing that more and more of their mothers, so the generation ahead of us, coming in and saying, what did I miss? You know, there's a little bit of resentment about that loss, being that lost generation where they didn't have access to the options. And as we all know, women love options and they love knowing what options are available to them and having a conversation about it. So I think, one of the greatest travesties that I experienced when I was practicing OBGYN is women that were suffering from menopausal symptoms, hot flashes, night sweat, sleep disturbance, energy levels down, feeling like they couldn't concentrate, brain fog, etc. And when they spoke with their other physicians, they were told, you'll grow out of it, grin and bear it. This too will pass. And in some cases, they were told, I wouldn't give hormone replacement to my dog. So obviously that's problematic. The good news is that the majority of that information, that black and white, it's good or bad, it's safe or unsafe, that study, the Women's Health Initiative study, has really been looked at again. I like to say that it's been debunked, but I've been corrected. It has not been debunked. It's just been reanalyzed and put in a different perspective with the understanding or the caveat that it was done on hormones that are not being currently used. So all of those studies, or all of the information, was on Premarin and Provera, which were given to women beyond menopause. So the average age of women in the study was over 60. So these were not the 45-year-olds, 50 and 55-year-olds that were actually suffering. These were women without symptoms that may have other health issues. The difference now is that the most common hormone replacement, which we call menopausal hormone therapy, is transdermal. So it comes in various forms, either patches, creams, lotions, vaginal rings, all of them where the estradiol is absorbed through the skin or a mucosal surface and bypasses the metabolism of the liver and therefore is considered to be safer because it removes the blood clotting risk that many people talk about, and you get the doses that are actually applied as opposed to taking something by mouth. So the transdermal bioidentical hormone therapy is what is the most popular and widely used, and then oral micronized progesterone. So again, a bioidentical hormone rather than something that's manufactured in a lab or extracted from pregnant horse mare's urine. What's really being talked about now in many, many different venues is testosterone. And how should women access testosterone? Do we really need it? How come it's not FDA approved in the United States, but it is in other countries? What studies are there? And that is an area that we are still talking about. We know it's very, very important for energy levels, oftentimes for sex drive, but too much, or in application in places that go in but cannot be removed, like pellets, are not recommended.
And I have read that in Europe they can have women doses of testosterone, and we just haven't figured that out here yet.
Right. the FDA has a different approach. There was actually an FDA expert panel where they interviewed, I think it was 7 different physicians, and asked them to come forth in a panel type discussion and make an argument for why women need to have more studies performed, more research needs to be done, and we need to remove some of the black box warnings that are present on many of the estrogen, progesterone, and testosterone formulations. I'm really saying that this is something, many of them have been very well studied, and we're presenting them in a fear-based manner that really is compromising advancement of women's health.
One of my favorite parts about being this age is that I feel like women are very generous with their knowledge, and that we are helping each other navigate this quite a bit. And that was my path to hormone replacement therapy, was a phone call, a conference call during COVID with a good friend from Newport Beach, my friend Julie, who said on a call with maybe 6 or 8 other menopausal age women, I'm on hormone replacement therapy and it has changed my life.
Right.
I was experiencing a variety of symptoms. She told us what those were and said it was life-changing for me. And if anyone on this call needs a recommendation to a hormone-friendly OBGYN, I'm happy to recommend my doctor. But if any of you are suffering any of these symptoms, let me know and let's talk about it. And my next appointment with my OBGYN brought up some of those things, because I don't think I realized fatigue, irritability were also signs. Friends are talking about this, but I think that sharing of information has taken it from something that was maybe taboo in our mother's generation, that we're open about it. We've got influencers now, and I'm grateful to all the women, particularly Julie, if you're out there listening, for sharing the information.
Oh, that's lovely. We all need a Julie for sure. Yeah. But, that's what I've always said, is that women are like bees, and we love a hive. We love to get together and talk about things. And now it's okay to do that. We don't have to suffer in silence. And for many, menopause was a silent epidemic, and they oftentimes didn't know until they came out of it on the other side. And that's actually one of the messages that Dr. H.E.R has been asked to really share when she comes to the H.E.R Summit, is that menopause and going through that transition can be something that is very, very positive. And you come out on the other side of it, and you can be more vital and more aware and with greater community, because you have talked about it, lived through it, and found resources together.
So Dr. Mary Claire H.E.R is a wonderful resource, and my beloved OBGYN for over 20 years, Dr. Gigi Kroll, has great information on her Instagram. Are there other podcast books, other resources you can recommend to our listeners?
Well, Oprah is actually a great resource. She has really tried to mainstream that conversation and brought in many specialists. And so has Brene Brown. They really have just kind of busted it open and allowed those conversations. There's an amazing speaker who talks about cognitive health. So our brain, our thinking, our functioning, Lisa Mosconi. And I found her to be a really great resource. One thing I will say is that there's no single source of information, because everyone wants something a little bit different. I've heard, Mary Claire H.E.R has a book called The New Menopause, and in 2026, she's publishing a book called The New Perimenopause. And for many people, they say it's too specific, it's too scientific. They just want kind of a general conversation. And they also want to know, once I've resolved my hot flashes and my night sweats, and I'm not suffering those ways, I'm still a little bit irritable. I still don't have much of a sex drive. Can we talk about the things that were lower on my list? You've solved some of the problems, but not all of them. And this is midlife, or this is later in life. And they want the resources. I would say look for Oprah, look for Brene Brown, Mary Claire H.E.R, and some of the FDA experts that were on the panel.
You're currently serving as president of the board of Moms of Orange County. Can you tell us a little bit about that organization and your work?
Moms Orange County is a nonprofit that is based in Santa Ana with the goal of raising healthy moms and healthy families. So by providing education, additional resources, and home visitation to vulnerable women, they are trying to strengthen our community. So probably one of the most exciting things that I've been involved in my last 2 years as the chair of the board has been that shift to mental health resources and intimate partner violence resources for the women that we serve, and having dad's classes. So really engaging, and it doesn't have to be the actual biological father. It can be a father figure, a grandfather, a brother, an uncle, or the father. We're seeing amazing progress in helping women feel more confident and competent and cared for during a very vulnerable time, which is being pregnant and postpartum.
Well, that sounds like a phenomenal organization.
It is.
We can't let you go without asking for one or two pieces of general health advice for us and for our listeners.
You can't make it sleeping more because Whitney would be very upset.
She's the 4-hour a night sleeper. I have two pieces of advice. One is marry the right person so that you can I could wave the white flag of surrender when I needed something extra for myself. When I felt like I was, or when I do feel like I am at my wit's end, or I need some alone time or some me time or some girlfriend time, I just ask and say it's one of those times. And so I think I've seen that 90% of your happiness and your success in life is who you spend it, or who you choose to spend it with. That's been very true. So choose wisely. And then it's become a little bit cliche, but it's girlfriends. It really is having other women that you can rely on, that are there through thick and thin, that love you, whether you have makeup on or whether you're in the corner after feeling like you're on your knees from a tough spot. So I think friends and who you spend your life with are the two keys. I do like to sleep though. I don't know why I went into OBGYN, because I love a good 8-hour sleep every night. And one little tidbit that I have is that I meditate before I go to sleep, or I do either a guided meditation or a self-meditation before I go to sleep.
Thank you so much for being here with us.
Thank you.
We really appreciate it.
And I know you've impacted so many women in Orange County. So on behalf of all of them and their babies, thank you for the work you've done and for being such a leader in our community. And to our listeners, thank you for joining us and getting your recommended dose of civics and civilization in Orange County.
We'll see you next time on Vitamin OC.